side. This is like a side view. This thing is the, anybody remember from last week, what's the name of the bone in the back of the head? Begins with the O.
Occipital.
Occipital, occiput, good. The occiput, this is the occiput. This is the bone that actually attaches to the spine when our head sits on the spine, so that's why it's on here. But if you were to look at the spine from the side like this, it should not look straight. Our spine has curves to it. So you'll see, what do we call the neck region again? What's the term? Cervical. The cervical will have a curve like this. I'll move the occiput over for a second. The middle back is what? Thoracic. Good. Has a rounding like this. And then the low back, right down here, which is the lumbar, has a curve like that. So when you look at the spine, I exaggerated a little bit. When you look at the spine from the side, it should be S-shaped. It should not be straight. So I want to talk to you a little bit about that. Take a look at this guy too. Cervical curve is facing forward. The thoracic curve kind of goes backwards. The lumbar curve is facing forward. So I just want to show you real quick. Ah, there it is. Thank you. Put it over here. Thank you so much. So watch this. When you're developing as a fetus, you guys are familiar with the fetal position? When someone's in the fetal position, they're kind of curled forward, right? Let's say we have a baby, little Junie here, and the baby's spine is like this in the fetal position. This would be the spine. This is the sacrum, so it's curved forward. Everything's curved forward. This curve right here, guys, that's the fetal position, we call the primary curve. Right? Primary means what? The first curve. It's the first curve that you're born with. And it's in the shape of the fetal position. Now, watch what happens. Every baby's a little bit different, but maybe a month, 2 months, 3 months. Again, every baby's a little bit different. Can you picture a baby laying on their belly and they start to lift their head up and they're holding their head up, and then you hold them and they start to hold their head up? So what happens is this. The cervical curve starts to change its direction. It doesn't face backwards anymore. It actually goes forward this way. Like this. See how it changed direction from the primary curve? So since it developed after birth, we would call this one a secondary curve. And again, it's because Junior starts lifting their head up and holding their head up. Then, maybe 10 months, 11 months, can you picture the baby maybe standing at like a living room table, and they're not walking yet, but they're standing, right? They're just kind of standing up before they take these first steps. Now this lower back curve starts to change direction, and watch what happens. I'll erase this a little bit, and now the lumbar curve hollows out in here. So take a look at our guy over here, same thing, you gotta get this hollowing out right here. So this is another curve that develops after, I'll bring this one down like this. The lumbar curve comes in afterwards. The thoracic curve always stays in the direction of the fetal position. It never changes. So the thoracic curve stays a primary curve, and then the sacrum too. If you take a look at the sacrum, it'll probably hard to see on my picture, but see this is kind of in the direction of the thoracic curve. So the thoracic and the sacral are primary curves, and then which two would be secondary? The cervical and then the lumbar. Once the baby lifts their head up and holds it up, the neck changes, and then the low back changes when they start to stand and then walk. Okay, and those are the curves that we should have. So it should look, again, something, I'll keep the occiput up a minute, cervical, in this case facing forward, and the lumbar facing forward. The thoracic and the sacral are going to be in the direction of primary. They're facing backward. Okay? So those are our two types of curve. Primary, the ones we're born with. Secondary, the ones we acquire after birth. Any questions on the curves or the discs, guys, before we look at the vertebrae? Everybody's with me? Okay. Good? can feel your enthusiasm this morning. I tell you, it's blowing me away. All right, so for those of you that came in a little bit late, in the suitcase there is a ring. Make sure everybody is holding a ring with the 3 vertebrae on it, guys. I want everybody to be holding one, and then if you haven't grab a couple sticks. Because remember, like last week, I went around and you had to show me things. Same thing today. Would you be able to show me stuff? You got this shit going around. You got that going around yet? Make sure you sign in. Sign in at the bottom for me, okay? On the oh, it's coming around. It hasn't come yet. Everybody has a ring. Should have 3 vertebrae, not 2, right? You have bones, my friend. You have bones?
No.
Yep, right there.
Oh.
Think about it. Everybody should have a ring. Yeah, that's good. Perfect. Perfect. You got it. You have a ring there.
You signed already?
Yeah, right in there. Watch this, guys. There's 3 vertebrae on there. Grab the one that's mid-size, not the biggest, not the littlest one, but the mid-size. Okay.
The moose?
You guys have your own? One for each, right? Dave, you got your own? Yeah, I didn't think so. Come on. Everybody has to hold their own. You got to do. The only way you can learn is if you're touching it. Looking at it, it's not gonna work. Okay. So watch this. We have 24 vertebrae in the spinal column. Instead of looking at each one individually, that would take a long time. What I thought we would do is this. Let's look at the features that are common to each vertebrae, and then go back and point out some of the ones that are a little bit different. So we can learn the common features. We can bang out a bunch of them all at once. So I want you to take the middle vertebrae size, and I want you to hold it the way this picture is over here. It's going to be something like this. Okay? It's going to be something like this. The mid-size one. That one's a good one. Not that one. Take this one over here. Yeah, take that one right there. This one, the middle one is the easiest one to learn. Now, let me just see which one you're looking at first. Good. Yeah, that's the one. Take that, the one closest to you. Yeah, use that one right there. Yeah, that's a good one.